Mainly, I want to talk about a little bit what homeopathy is. I don't know if everybody knows homeopathy. Then I want to talk which remedies mainly, the mainly three remedies that we use for hemodialysis patients. If I would like to introduce myself, I'm a medical doctor. I am currently the vice president of the World Homeopathy Association. It's Liga Medicorum Homeopathica Internationalis. So the first thing that I would like to say is what homeopathy is not. You know, homeopathy is not a treatment with plants. It's not phytotherapy. It's not a supplement therapy. It's not a treatment for a specific indication. This is very important. Homeopathy is the treatment for the whole patient, and homeopathy is the second largest system of medicine in the world, and it should be definitely integrated everywhere. It's a part of medicine. Hopefully it will be in the future. And homeopathy is a holistic medicine which uses specially prepared, highly diluted substances with the aim of triggering the body's own healing mechanism. So a homeopath will prescribe medicines according to the patient's specific set of symptoms and how they experience them, taking into account their overall level of health. Homeopathy is a natural form of medicine, and we treat both acute and chronic conditions. And it's a gentle, natural healing discipline that works with the body's own capacity to relieve symptoms, restore vitality, improve overall health. It's a holistic approach, and it's an individual therapy. So we don't treat, in homeopathy we say we don't treat illnesses, we treat the patients. And the homeopathy's basic principle is similia similibus curantur. This means like treats like, and that is a substance which can cause symptoms when taken in large doses, can be used in small amounts to treat similar symptoms. For example, drinking too much coffee can cause sleeplessness and agitation. So according to this principle, when made into a homeopathic medicine, it could be used to treat people suffering from sleeplessness, agitation. So coffea cruda is our remedy, and we use it mainly for patients who have sleeplessness because of agitation, because of thoughts, and who are agitated and very excited people. Homeopathy was discovered by a German doctor, Samuel Hahnemann, who was looking for a way to reduce the damaging side effects associated with the medical treatment of his day, which included also poisons. He began experimenting on himself and a group of healthy volunteers, giving smaller and smaller medicinal doses, discovering that as well as reducing toxicity, the medicines became more effective as the doses were lowered. He also observed that symptoms caused by toxic medicines of the time, such as mercury, which was used to treat syphilis, were similar to those of the diseases they were being used to treat. So this is like cures like. So very short homeopathic introduction. So how do we help as homeopath in renal diseases? Most of the patients that we see, that I see as homeopathic doctor, and most of the homeopathic doctors see, are in the chronic renal failure stage. We don't see acute renal failure patients because they go mainly to the hospitals. Also in India, there are many homeopathic hospitals, and they have more experience in this. And most of the patients, they want to see if we can help them during hemodialysis or reverse the illnesses, which is not possible, of course, especially during chronic renal failure or end-stage chronic renal diseases. Because homeopathy works with the capacity of the body and the healing power of the body. If the organ or tissue is damaged beyond healing, if the damage is not reversible, also homeopathy cannot help. But however, we as medical doctors and the medical science, I think we only know 5 or 10% of the body functions and how it really works. And every day we discover new molecules, new pathways, new functions of the body. And I think body's healing capacity is incredible. It's a miracle, and not the remedies, not the approaches, not the medicines are healing the body. The body itself heals itself. We're just helping the body. So, and we every day see miraculous healings, which I think they are not miraculous. We just don't know how the body is doing it. And this is the area of homeopathy, because homeopathy really works with the body healing power. And we can help in this chronic renal failure part a lot to the patients. So what do we do as homeopathy? If we can see patients in the acute phase, I mean, in acute renal nephritis, for example, if we give homeopathic remedy, we use mainly organ-specific remedies for most of the renal patients. Patients with renal diseases. In the acute phase, we can improve the renal functions, and especially we can improve the psychology and the mind of the patients, the nausea, the weakness, and etc., many things. And we can prevent to go to the chronic phase, or we can prevent also that the patient goes in the hemodialysis. And for this, we also use constitutional homeopathic treatment, which means we treat the patient as a whole, from mind to the food and all the systems, plus organ-specific homeopathic remedies. But the second part, the chronic patients with hemodialysis, this is the part we see most of the time. Most of our patients are this. I have many patients like this. The best thing that we can do for these patients is improving the quality of life and improve the immunity and to restore the balance in the mind and psychology. And we can reduce the frequency of hemodialysis. We cannot prevent it actually, but we can reduce the frequency, and we can reduce like itching, the side effects of hemodialysis, or sleeplessness, like Dr. Ahmet said, and many other side effects. And for this, we do mainly palliative homeopathic treatment. As I said, for homeopathy, cure means that every function is optimum, or everything is in balance and there are no diseases. So in the chronic renal failure part, if the patient's in hemodialysis, we mainly do homeopathy as palliative care. And I would like to emphasize again, homeopathy should be used in those patients, especially as integrative and complementary. I am against cutting off all the medicines. Some are doing this. This is not right. Homeopathy should be complementary in this part, and it will really improve the quality of life of the patients, especially with organ-specific homeopathic remedies. We rarely see patients after renal transplantation, but we can also help them with palliative homeopathic treatment for quality of life. The most important thing is, what I want to say is homeopathic remedies, because of their preparation process, they have rarely side effects. They can be easily used with other regular medical medicines, Western medicine, let's say, and they don't interfere with them, because the effects of the homeopathic remedies, how they affect the body, is very different from the Western medicines. So they can be used very easily and very softly together as complementary. There are many, Dr. Ahmet didn't say anything about homeopathy, but there are many homeopathic articles about homeopathy on renal hemodialysis, or nephritis, other things. You can find it in PubMed. I don't want to say anything more about it, but how do we help? So homeopathy is a holistic approach, and homeopathy brings back the homeostasis to the body with homeopathic remedies. This means we are taking the patient as a whole, even if it's acute or chronic. And in both situations, but the approach in chronic and acute is very different. But in both situations, we don't only take the symptoms of the renal functions. We also consider the mind, the accompanying symptoms like sleep changes, gastrointestinal symptoms, or heart symptoms, whatever. And in every case, acute or chronic, we can give different remedies to different patients with the same illness. And every homeopathic remedy has a different materia medica, this means drug picture, and this has to be individualized. So I would like to give you some of the organ-specific homeopathic remedies that we use. There are many, but I will just give you 3 examples, so how you can see how we pick up the remedies and how we use them. Helleborus, Apis mellifica, eel serum, and apocynium are the most used for remedies, and I mainly use eel serum and Apis mellifica. So I would like to give you a few examples. Eel serum. Eel serum, Serum anguillae, is the serum of the eel. It's very toxic, so mainly we use it in 30C, in 30 potency. It is the most used, about 80% of the patients need it who are on hemodialysis. It is the most used homeopathic remedy. You can use it every day without any effect. And we should bear in mind that the elective action of the eel serum is on the kidney. It's an organ-specific remedy. And I believe we can well assert that if digitalis is a cardiac, eel serum is the renal remedy. It's so specific. It's very specific, especially during acute nephritis. It has oliguria, anuria, albuminuria, and it has renal hypertension as symptoms. You will see that I will write many symptoms as of the remedies. Homeopathic remedies are like human. We treat them as a patient, and we talk of them as if they are a patient. So if I say eel serum has oliguria, this means it can help patients with oliguria. So eel serum is mostly used in hemodialysis, and especially in acute nephritis. It's a very well-known remedy, especially in India. I don't know if it's mostly used in Europe. Also in Turkey, they don't know very much, because I went 3 times to India to some hospitals for homeopathic study, and I learned eel serum there. Apis mellifica, it's honeybee. It's a very important remedy also for many situations, also for patients who have especially edema. It's an explosive remedy in many respects. This means the symptoms of the patients are very explosive, very strong. And Apis mellifica has edema mainly in eyes, face, throat, uvula, ovarius. They are really puffing up. They are very puffy, and all of the body is puffing up without any color. They are like transparent, and the very important feature of Apis is distinguishing it. It's very important to distinguish it with the other remedies. They are hot patients, and they are ameliorated from cold, and they are aggravated by heat and touch. The patient doesn't want that you touch them. They have very dry skin. It's very effective in proteinuria. I used it many times for nephrotic syndrome. Should be mainly used in 33. And Apis indicated in cases in which the kidney suddenly fail, and from one day to the next day, an enormous edema develops in the lower limbs, and you can almost see the increase of the swelling 1 hour to the next. It is very explosive. I mean, it has edema everywhere. And the other very important symptom of Apis is they are not thirsty. This is important. You will see in other remedies, it's different. Aposinum cannabium, this is also a homeopathic remedy. We also use it in hemodialysis and in end-stage kidney diseases a lot. It has also dropsy, but it has mainly anasarca and hydrothorax. And the dropsy is characterized by great thirst. It's not like apis. If the patient needs apis, the patient is not thirsty. If the patient is thirsty, is like apis, then we think of aposinum. The patient is emaciated and prostrated, and how he does not gain, and now he does not gain flesh. He has no appetite. He drinks copiously. He seems to want nothing but water. The patient wants just water. He doesn't want to eat anything. If he eats anything, then he vomits as soon as he eats, and he has diarrhea immediately after eating. Also, she or he is vomiting as soon as he drinks. And the patient can have confusion. Also, apis can have confusion. And one of the most important things is aposinum is aggravated from cold. Apis is aggravated from hot. Aposinum is aggravated from cold, and he doesn't want anything cold. He feels if he could, he is dry. He feels if he could only perspire, he would get well. There is no outthrow of water. He drinks plentiful, and it goes into the cellular tissue to distend them, and he becomes dropsical. He has a water constitution, one that takes in water and lets out none. Also he is drinking, but nothing comes out, whether from the skin, neither nor from the urine. And you see at once how different that is from apis mellifica. Anyone who follows symptom hunting and does not distinguish between circumstances that relate to the patient and modalities that relate to symptoms cannot appreciate these two grand distinctions, where the one patient is aggravated from heat, the other one is ameliorated by heat in all complaints. For example, apis suffers directly from dry skin, also from scanty urine, yet apis is aggravated everywhere from heat and ameliorated from cold, and this is vice versa in aposinum. So aposinum and aposinum cannabinum and apis mellifica are very similar, just the modalities are different. They are very helpful during many renal diseases, and they are very often used also in India in the hospitals. Unfortunately, they are not homeopathic hospitals in Turkey. We have just we can just use it in practice. Helleborus niger, this Christmas rose, is very poisonous. It is also used in surgery mainly. It is also one of the remedies that can be used, but Helleborus is very wild, the symptoms. They have suddenly anuria, and they suddenly go to complete unconsciousness. They are stupefaction. They pick lips and close. They have acute delirium. They have just staring there and not answering, or very slowly answering. And they have no urine, like I said, anuria. They have suppressed, or if they have some urine, it's scanty, dark, and sediments like coffee grounds. They are, of course, dropsical, and they are thirstless. It is less used because it has a very wild symptomatology, but it is to be considered. So, as a conclusion, what I can say is constitutional homeopathic treatment is efficacious in treating non-dialysis dependent chronic kidney diseases and is an important non-interventional option. Palliative homeopathic treatment using organ-specific clinical remedies has proved to be a great value to patients of end-stage kidney diseases. Unlike renal replacement therapies, homeopathic treatment helps in both prolonging life and maintaining or improving the quality of life. Homeopathic treatment is effective in reducing the frequency of hemodialysis in patients of end-stage kidney diseases. Our practice and experience showed us that end-stage kidney disease patients on both homeopathic treatment as well as hemodialysis have a better quality of life as compared to those in hemodialysis. Thank you. I hope it will be helpful in your practice, and you can use it, and you can include it somewhere.
Eu disse pode tocar fogo, queima todo o cabaré, mas eu não vou largar tão cedo dos braços dessa mulher. Você é ciumenta e não larga do meu pé, suspeita de todo mundo, vive vida da mulher.